Good afternoon, guys. We're on the podcast, my favorite one, the Captain's Log, of course. And Dr. Mel Irvine is with us. And Dr. Mel is going to tell us the good, the bad, and the ugly about birth control. And also, we had this original conversation the other day when we were doing Botox on me, which you did a great job. It's starting to freeze really well.
Thank you.
But you're saying that the teenagers are getting a lot of birth control. Now you're seeing some of the side effects coming in, and I guess that's what prompted our conversation. So tell me a lot about it.
That is correct. So birth control, specifically oral birth control pills, we're not really talking to girls and young women about how this is going to physiologically affect their bodies and change their bodies and affect their hormone levels, specifically testosterone in these girls. I'm not a proponent of women being pregnant all the time, but there are other options, and we need to talk more about those options with these young women.
And you say pregnant all the time, you mean that's what your body thinks is happening when you're on birth control?
Yes.
Is that why?
Yeah.
Okay, so then there's going to be some negative side effects? There's some positive things, right?
Good things. It prevents the pregnancy. Some people use it for, we were talking about the acne. Some people will go on it to control menopause or to control premenopausal symptoms or their menstrual cycles. And we're putting a lot of people on it for other things other than not getting pregnant. And because of that, we're starting some young girls at 9 on these birth control pills. And by the time they're 20, they're in my office because now they're having a lot of pain with intercourse and vaginal changes. They don't feel right. Their moods aren't where they need to be.
What happens actually down below when that happens?
They begin to have pain with intercourse. The tissue begins to thin. It becomes almost raw, very painful. They can tear. And for a 20-year-old woman, it's not exactly something that you should be experiencing. Sometimes I see these girls and it's like I'm looking at 70-year-old women. And
you actually look at a lot of women because you not only is that your field, but don't you do some kind of reconstruction down there too?
I do. So we have a number of treatment options in the office. I do, vaginal hormone replacement therapy. We have a CO2 fractional laser in the office. I perform the O shot, and I counsel women on the different treatment methods and what's going to best fit their needs.
So these kids, is this kind of like a new thing for this generation coming up, or has this been going on for many years?
It's been going on for many years. The good thing is the newer, younger generations are open to talking about it.
Okay.
So it's no longer a taboo thing. They know they have a problem, and they are looking for the providers that can treat them for it.
And the problem has occurred because you were telling me, let me see if I can explain this right.
Okay.
So you're saying that the outside vaginal wall is affected by testosterone.
Actually, it's a lot of vaginal tissue. So different vaginal tissue is dependent on different hormone. The clitoris is very testosterone dependent.
Okay.
The vestibule, that's right outside the vaginal opening, very testosterone dependent. There's tissue on the anterior or top vaginal wall where the urethra runs, and that's where your G-spot is, ladies. That's also testosterone dependent. And then you have estrogen and progesterone,
and
which
they
are
need
also
the testosterone to what? Stay like...
You want that tissue, the vagina is meant to be wet and moist, healthy, pink, and plump.
I can't help but say you're so serious about when you say these things.
Yeah. Oh, well, there's such a taboo about talking about the vagina, the vulva. Those are not bad words. Like, we should know our anatomy, and it should be a normal part of the conversation.
Right.
So, yeah.
So, moving on, is this more of something for the younger girls that you're seeing, or you're seeing it for all?
Every woman.
So right now, you're saying that it's from the pill, though, specifically.
We're finding that it does affect the pill. As women age, our hormones do begin to change. You have premenopausal, perimenopausal, and postmenopausal women. Our hormones change throughout our lifespan. Once a woman gets to the age of menopause...
you lost me on the 3 pauses.
Yeah, there's all kinds
I need all pauses. Tell me what they are.
So, premenopause, that's when a woman is still menstruating. She's, her hormones should be optimized, but again, we have a lot of hormone disruptors in food, birth control, chemicals that we're exposed to. And then you have perimenopause, which begins 8 to 10 years before the onset of menopause. And women are actually having symptoms of menopause well before menopause actually sets in. When menopause happens, the average age is about 52 for women. This is every woman's reality, no matter how old she is.
You can't avoid it.
You cannot avoid it.
Okay.
And it is not a symptom. It's not a hot flash or difficulty sleeping. It's a physiological change in the body that she will live in for the rest of her lifespan until she dies.
Okay.
So there are things that we can do to maintain her and her quality of life throughout that, transition period, and when she's in menopause, to maintain her quality of life so that she can go on to live just as good a life as her partner.
Do you have the same sex drive during all those periods?
No, and specifically we're seeing that affected with the testosterone levels. Again, with the birth control, it's affecting libido in women. I always start with hormone, and then there are other options.
The libido goes down, yeah?
The libido goes down.
Okay.
And that's something that women struggle with in general, but we have options. Some of my favorite options for women are Addyi, which is for hypoactive sexual desire disorder.
We did a study, a podcast about
and
that
now
with Dr.
there's
Dalla.
the new Vyleesi, which is an injection that you give yourself. It's an on-demand injection, which makes you horny as hell. And I love
No way.
It does.
How does that work?
So you give yourself the injection. It has a 13 to 16 hour effect. It works on melanocortin, which is a different pathway from what Addyi works on. And melanocortin receptors in the brain, we also have it on our clitoral tissue. Women, I suspect, though, have to have healthy vaginal tissue for Vyleesi to truly work the way that it should. But
Casey, we're going to get your question in a minute. We're going to get to the O shot.
It works very well. It makes you horny as hell. You need to make sure that you're ready for it.
Really?
Yes.
So you're like just wanting to just get it on right away.
I love it.
As soon as it hit, how long does it take to hit?
It depends. 45 minutes.
How much did you take today? Because I can tell you're definitely
I don't take it when I have to be at work.
With me.
I love my patients, but I don't want
obvious.
to.
No, just kidding.
I don't want to be thinking about, having to get my relief at work.
Right.
So you definitely, this is a medication you're going to take when you have a day off. Make sure your partner's in town. When you go on vacation, it's a great medication for that.
So it's basically the equivalent to a guy popping a Viagra or a Cialis.
No, it's very different.
Oh, tell me.
Because Viagra and Cialis, all they do is they open up blood vessels.
Right. They just make it more sturgeon.
And that's the mechanism to an erection. And women have erectile tissue too. Our clitoris is an erectile tissue.
Right. So can the guy take this stuff too?
They absolutely can.
Oh, is it made for guys and women?
It is actually FDA approved right now in women. Addyi is working on getting FDA approval for men, and Vyleesi, at some point, I'm hoping will also work on getting FDA approval
I should be
men.
part of that study. You should.
But I do prescribe it to men.
Really?
And yes, they do have access to it.
Wow.
Yeah.
I find it hard that a lot of guys are not as horny as you believe. Aren't guys always horny? Don't they say that guys talk about sex and think about sex every so many minutes?
Things are changing. Again, we have an environment where our food is different in this country. We have a lot of hormone disruptors. We know testosterone levels are being affected in men. And we do get men in our office complaining about, hey, my libido isn't there. And typically, in the past, before all of these changes in our food and these chemicals we've been exposed to, these guys thought about it a lot.
Yeah. Casey has a question. She chimed in. What is an O shot? I know what it is, but you need to explain it because you said it very quickly, and I saw she picked up on it. But I need you to explain to all the listeners now what the O shot is, because I'm a big fan.
Okay. So the O shot is platelet-rich plasma, where we draw your blood, spin it down, and
PRP. Everyone knows that. Yeah, that's the new.
So when we get that, we inject it back into the tissue, and we inject it in a woman in several different areas to essentially rebuild and regrow healthy vaginal tissue. That alone, I use a multimodal approach to care. I do a couple of things. I do O shot. I always look at hormone in all of my women, and sometimes we do the laser as well. And the O shot has been known to increase sensation and help women with orgasm, because that's something women struggle with.
Right.
Only 25% of women can orgasm with just intercourse alone.
I just heard on another podcast that I don't know if you guys are doing it yet or you are doing it at the present time, but are they doing the G-spot shot, which is they're doing the same PRP in the G-spot?
It's the PRP injected into those areas, and I do inject it into that area. So your G-spot essentially is on that top vaginal wall, and we're injecting the PRP into that tissue.
And that makes it more sensitive.
It helps to, again, restore the tissue to a healthy state so that you can have your internal orgasm clitoral orgasm. There's multiple
We're just
ways
giving
women
out
can
orgasms
orgasm.
like Oprah. We're
Yeah.
giving everybody one.
Yeah, there's cervical, or there's
I
so
like
many
that.
different ways a woman
Okay.
can orgasm.
Okay. So we went from the birth control to orgasms inside and out. So that's
We're
good.
probably going to need different,
we want to make sure we cover
different
everything.
shows for each topic because there's so much about each one of those.
Ada, thanks for watching. Catalina, I appreciate you guys tuning in. We're on the Captain's Log right now. And Dr. Mel, you have, I guess what you want to say is what? A specialty in female and men's sexual well-being? Is that what you call it?
Yes.
Or sexual health?
Sexual health. And for women, it's about overall health and well-being. We, started the practice as a sexual health practice and have realized it's grown to be so much more than that because I actually have a lot of patients who are not sexually active that come to our practice, females.
Trying to be more sexually active?
No, they're having issues because sex is great and I want to optimize that. If women are going to be having sex, I restore orgasm for them because if they're going to be doing it, I think they should be having their happy ending as well. But as far as women in the vagina, it's not just for sex. It has to do with your overall health. And as you age, those changes can affect you.
And this whole discussion started by the fact that you're seeing these younger patients come in who have been on birth control for a period of time, the pill.
Yes.
And you suggest that, you do what is it called?
There's IUDs, there's
IUDs.
implants like the Implanon or the Nexplanon.
Hey, Dr. Doll is
acting-
watching. What's up, Doc? Hi, Mickey. How are you?
The longer acting birth controls are the preferred methods of birth control, or vasectomies if you've got your kids. Have your partner go get that vasectomy and
because
get off that birth
there's
control.
very little side effect to that. And
Yeah.
if the woman is taking the birth control, like you mentioned, she's going to be there's just side effects that happen because of the chemicals,
That
right?
is correct, yes.
Yeah.
And there's a lot of women that can't tolerate them. They don't feel right. Again, their moods change, and it's changing their bodies. And even when they come off that birth control, their hormone levels never go back to what they would have been had they never started it to begin with.
Okay. All right. Well, look I learned a lot. You guys, where can they find you on the gram? Casey asked, and some other people want to know how they get a hold of you on Facebook, on Instagram. Where can they find you? Give all your information out so everybody, if you want to talk to her, ask her questions. If you want to DM us, we'll get your questions answered the best we can.
Yeah. My Instagram is dr.mel.irvine, IRVINE, and you can email me at mel@sextys, SEXTYS.com, and that comes directly to me, and I'm pretty quick to respond to both.
Well, we appreciate you coming out. This is the Captain's Log, guys. We're going to be back tomorrow. I got a great show for you. I'm not even going to tease it, but it's a good show. I promise. We're going to have fun. And that's it. Let us know if you like the show. Give us a good rating. We're out. This is the Captain's Log.
Thanks.